In this video, I'm going to show you a few versions of hip flexor stretches to help out with groin pain. Hey, I'm Sebastian at Performance Place Sports Care, part of the locally world-famous chiropractors in Costa Mesa, California. Before we start on this video, I should describe where you may feel problems at to make sure you're watching the correct video. So groin pain is right into the front here. It's in the crease. Sometimes people will feel it down into this region here, a little bit into the outside. If you're dealing with something like lower back pain or leg pain down the back side of the leg or into the shin, there's a possibility you have something else going on. So the problems that I'm specifically looking at today is going to be something related to the front side of the hip that doesn't feel nervy, it just feels pinchy. Now there's a few versions that many of you have probably tried. I'm going to use this as the last version. Some of you may have used a couch, so that may give you an idea of what it is that I'm talking about. However, the hip flexor stretches that usually work best for people, quite honestly, are ones that people can get the most volume in. And I mean volume, I mean how many times they can do it in a day. There's standing variations, which I won't necessarily show today, but the kneeling ones, like even if you're working at a desk, you can take the chair away, use this as an assistant to the chair, to the movement, and just do the hip flexor stretches while you're actually typing on the computer or you're looking at numbers, if you will. And so all we're going to do here is we're going to take the knee and bring it backwards. You have to have a comfortable surface back there on the knee, because if not, you're never fully going to get through the range because it's so uncomfortable on the back knee. It shouldn't be uncomfortable. It should just be stretchy on the front of the hip. Now I'm showing you with my right hip, the other hip as being the one that I'm treating right now for the groin pain, mainly because I got the box as the support on that side there. Okay, I'll flip sides here in a couple minutes just so you can see. But all I'm going to do is just rock my pelvis on this side. Oh, forget it, I'll just do this side so you can see. I'm going to rock my pelvis on this side down towards the floor that way, okay? The reason why I'm saying rocking it down that way is because oftentimes people will do this. They'll arch back. It's like if they had a flashlight on their hip, their flashlight no longer shines to the ground. It's like it's drifting up into the heavens. And so the reason why this is significant is because if you're trying to deal with groin pain and get some hip flexor stretching to accomplish that, all you're doing is extending your low back mainly. You're doing some hip extension, but oftentimes people who extend their hips so far and their low back so far, it just ends up hurting their back so they can't get any more hip movement. And so we're going to go through range here and do about 20 reps total. Now I want you to notice here that I had to put my hand over here, because if I had my hand towards you, if you look at my zipper of where I don't have a zipper on these shorts, but if I did, my zipper is no longer forward, it's drifted towards you, which no longer allows my hip to get the extension I'm looking for. I want to make sure to close that off. And so what I would be doing is using the side that I'm stretching is going to be the side next to the chair, the couch, or in this case, the block, okay? I actually like this thinker position that I have here. It's really easy to allow your back to settle when you're doing it, okay? And so what that does is the opposite of what I mentioned earlier. This helps me keep my back more honest, okay? This is version 1. Version 2, we're going to add some hip internal rotation with the extension. Not everybody can do this. And a lot of times people need a box, mainly because they'll kind of fall over and lose their balance too. And so the way we're going to do this here is we're going to take our foot and move it, in this case, away from the camera, which creates relative internal rotation of the right hip, my right hip. And then I'm going to rock in, okay? I won't be able to go as far, and that's okay. It's because we're challenging a slightly different range, all right? I still got the thinker. I still got the support over here. And I'm still just going through the range that I can take without drifting out of the position. Shoot for about 20 reps or so. By the way, it's important to note that you don't have to do all these at once. Most people get better benefit if they can do it throughout the day, Hence why I started with the video, I talked about volume. Doing volume throughout the day is better than doing it all at once. But for the sake of video, we're just going to do a bunch at once. Okay. Now this is option 2. Option 3, we're going to go back to the neutral position here. But in this case, I'm going to show you a little bit from, actually we'll do the front view in a second here. This one is going to be a little bit more of a reach and low back stretch with it. So I'm going to lean towards, just as we did in the first one, and then we're going to take this opposite hand and reach over. Okay? From the front, here's what it looks like. I'm going to rock in, slide my hand up a pane of glass and across the pane of glass, and down and rock out. Rock into the glass, hand and elbow on the glass, slide up the glass, reach around the glass and back. Okay, it's like I'm a mime. Okay, I'm not going anywhere closer towards you as I'm moving this way. Okay, rock in, hand on the glass, slide up the glass. The glass also is over here too. Okay, so that's another version. The last version we're going to do is the couch stretch. Okay, quite honestly, most people shouldn't do this one. Okay, but there are some people who will tolerate it. Okay, you normally will need something soft, and again, you'll want something on the knee that's soft as well. Okay, I don't have anything soft here, so I'm not going to be in this position very long. But in this case, it's the same exact stretch, but you're adding a little bit of knee bend. And so the same things happen. Roll the flashlight in, thinker position, and then rock the flashlight towards the floor. In this case, you're going to feel a bigger stretch down the thigh than you do locally at the hip. So essentially what this one does is this one stretches more of the rectus femoris muscle, which is a quad muscle that goes above your hip to your knee. But because the quad muscle is at so much tension, I'd venture to say you actually get less hip extension than you do with the regular ones, mainly because the tension of the muscle is actually limiting how far you can bring the hip to extension, and essentially you kind of have pre-tension at the muscle before you do at the hip. So this is an example of versions of hip extension stretches or hip flexor stretches you can do. The first one we stretched the iliopsoas group as well as a little bit of the rectus femoris, but this one targets a little bit more rectus femoris. And so it really depends which hip flexor you want. And if you want more hip extension, you may choose the early ones. If you're finding that you don't need hip extension because you already got enough and you need to do a little bit more knee bend associated with, then choose the latter. And so these are examples of how there's many options to exercises and stretches, but hand selecting the right one matters, okay? Normally when I have people go home and do hip flexor stretching for groin pain, I don't have them do all these. I have them do one. And I have them do one and increase the dosage on that one. Eventually, we make this active. So these are passive stretches generally. So this is to milk out the joint, to make it so the hip flexor relaxes a little bit, and eventually we have to build some strength around the area, which typically requires a little bit of glute max training, a little bit of pelvic stability, and a little bit of core work. And not the core work, which is sit-ups and Russian twists. It's more isometric, non-movement based. And so there's exercise that we typically pick beyond this. So if you guys are looking for help, we can help you. We see people virtually and in person. We specialize in low backs, hips, groins, and so on, the whole lower quarter right here. We also have a webinar too, it's in the corner, that covers different types of groin pain in the diagnostic category that you could be in. I'd venture to say that the webinar has more information than you've ever found anywhere on the internet about this specific topic. So please take advantage of it. And if you like the channel, if you like the video, please thumbs up, subscribe. We'll see you next time.